I'm doing my persuasive speech on physician-assisted suicide. I'm doing the introduction and a third body paragraph. My other partner, Wolf, is doing the first body paragraph about the 5 states that have legalized physician-assisted suicide. And my other partner, Adrian, is doing the second body paragraph about how it ends the suffering of terminally ill people. And Wolf is doing the conclusion. Physician-assisted suicide. Assisted suicide, also known as assisted dying, is suicide undertaken with the aid of another person. Unfortunately, in life, you can find yourself on the wrong side with cancer or a disease fighting for your life. Sometimes it gets to a point where a person is no longer living and they are suffering. Physician-assisted suicide should be legal because 5 states have legalized physician-assisted suicide. It ends the suffering of terminally ill people and lessens the cost of medical care. Physician-assisted suicide would result in tremendous savings on healthcare costs. As people start to get near the end of their lives, healthcare costs increase substantially. In a study done in the region of Manitoba, 20% of healthcare costs are attributable to a patient's last 6 months. Sadly, in life, you never know what tomorrow will bring, and you can find yourself on the wrong end with cancer or a disease. The result of these unfortunate sequences are expensive technological interventions. Going forward, it should be the patient's choice whether they want to continue to fight or end their suffering with physician-assisted suicide. In the U.S., there are 5 states that have legalized physician-assisted suicide: Oregon, New Mexico, California, Vermont, and Washington. In 2001, the Netherlands legalized physician-assisted suicide, and it went into effect in 2002. Every year, the Netherlands averages about 3,650 cases of physician-assisted suicide. In a study done on the Dutch patients that used physician-assisted suicide, 17% had their lives shortened by 1 day, 42% had their lives shortened by 1 day to a week, and 32% by more than 1 week to 4 weeks. 80% of the patients that elected to use physician-assisted suicide involved patients with cancer that elected to end their suffering. As a result, the average reductions of a patient's lives were 3.3 weeks. For these reasons, physician-assisted suicide should be legal. If this practice was legal in all 50 states, it would reduce the high cost of death, and for many families, especially the ones without health care, the savings would be substantial.